Can berberine really help you lose weight? Hey there! Have you ever wondered if there's a natural supplement that can help you shed those extra pounds? Well, today we're diving into the world of berberine. Could this ancient compound be the key to your weight loss journey? Stick around because we're going to explore the scientific evidence, real-world results, and everything you need to know about berberine and weight loss. Welcome back to the channel. If you're new here, don't forget to hit that subscribe button and ring the bell so you never miss an update. First off, we can't talk about berberine for weight loss without mentioning Ozempic. A lot of people have been discussing Ozempic as a weight loss aid for the last 2 or 3 years. It's important to note that Ozempic is also being used off-label for weight loss in non-diabetic individuals. This use is driven by its popularity on social media and its ability to promote weight loss as a side effect in diabetic patients. While Ozempic has been approved by the FDA for treating type 2 diabetes, its use for weight loss in non-diabetic populations is considered off-label and may carry additional risks. These risks require careful consideration by patients and healthcare providers, which we are not going to discuss in this video. For that reason, we're only making reference to it. However, today's topic has also been gaining a lot of attention lately: berberine. This powerful compound has been used in traditional medicine for centuries, but recent studies suggest it might also be a game changer for weight loss. By the end of this video, you'll have a comprehensive understanding of how berberine works, its benefits, potential side effects, and whether it's safe for you to use. So let's dive right in. First off, let's talk science. Research suggests that berberine may be effective in promoting weight loss among overweight and obese individuals. Several studies have shown modest reductions in body weight, BMI, body mass index, and waist circumference with berberine supplementation. 1. A meta-analysis of 14 studies found that berberine led to an average weight loss of 5 pounds, 2.3 kilograms, compared to placebo. 2. In another 12-week study, participants who took berberine lost an average of 11.2 pounds, 5.1 kilograms, compared to just 3.3 pounds, 1.5 kilograms, in the placebo group. 3. Yet another study reported that overweight individuals lost an average of 3.6% of their body weight over 3 months with berberine supplementation. These results are promising and suggest that berberine could be a valuable tool in your weight loss arsenal. So how exactly does berberine work? Here are some proposed mechanisms. Berberine helps regulate blood sugar levels by increasing insulin sensitivity and glucose metabolism. It inhibits the growth and differentiation of fat cells. Berberine increases the breakdown of fats and energy expenditure. It influences gut microbiome composition, which can impact metabolism and weight regulation. These mechanisms collectively contribute to its potential as a weight loss supplement. Let's take a closer look at some real-world results. 1. In one clinical trial lasting 12 weeks, participants who took 500 milligrams of berberine 3 times daily experienced significant reductions in body mass index, BMI, and waist circumference. 2. Another study found that taking 1,500 milligrams per day resulted in an average reduction of 5% in body fat over 3 months. These findings demonstrate that consistent use of berberine can lead to noticeable improvements in body composition. Beyond weight loss, berberine offers several other health benefits. This is particularly beneficial for those with prediabetes or type 2 diabetes. Studies have shown reductions in LDL cholesterol and triglycerides. Berberine has anti-inflammatory effects which can benefit overall health. It helps combat oxidative stress by neutralizing free radicals. These additional benefits make berberine not just a potential aid for weight loss, but also a boon for overall health improvement. If you're considering adding berberine to your routine, here's how you can do it effectively. The typical dosage ranges from 900 milligrams to 1500 milligrams per day, divided into 3 doses taken before meals. For best results, take it consistently every day. Always consult with your healthcare provider before starting any new supplement regimen. Berberine is available in various forms, including capsules and powders. Choose one that's convenient for you. Safety is always a concern when introducing any new supplement into your diet. Generally considered safe when taken at recommended dosages. Minimal side effects reported. A long history of use in traditional medicine suggests a good safety profile. However, it's crucial to follow dosage guidelines strictly, as higher doses may lead to gastrointestinal issues like diarrhea or constipation. While generally safe when used appropriately. 1. Some people may experience mild gastrointestinal discomfort such as bloating or gas initially, which usually subsides over time. 2. Rarely reported side effects include headaches or skin rashes. If these occur, discontinue use immediately and consult your healthcare provider. 3. Not recommended during pregnancy breastfeeding due to lack of sufficient research on safety during these periods. Always start with a lower dose, gradually increasing until reaching the optimal level suited for individual needs, preferences under the guidance of a qualified professional. Share your experiences with Berberine in the comments below. We hope you found this information helpful. If you did, please give this video a thumbs up and subscribe if you haven't already for more health tips. And share this video with friends and family who might benefit from learning about Berberine for weight loss too. Turn on bell notifications so you never miss a new video. That could help improve your health and the health of those you care about. Speaking of videos that could improve your health, don't forget to check out this health-related video on dietary fiber deficiency. 7 hidden signs you may be at risk. Just hit play.